Here, anemia classification: microcytic, normocytic, and macrocytic. Imagine this is the normal red blood cell. If normal red blood cell size is normal, we call normocytic, but anemia. So this is the red blood cell. In between red blood cell, this is iron. So problem, maybe the cell size bigger or smaller, or size of the cell is okay, but hemoglobin is not okay, less than normal, right? So if the cell size is normal, normocyte, but hemoglobin is less, it is called hemoglobin is normal, also normochromic. But maybe the number of the cell is not okay, we can so call anemia, but size is okay. Hemoglobin is okay. But maybe the cell easily break down. Cell is normal, okay, hemoglobin okay, but cell easily lysis break down and patient develop anemia. So normocytic, normochromic. Because size is normal, iron is normal. Chromic, okay, iron. Either it is the cell size is too big, but it is not working well. It is macrocytic. Macro, A, bigger. Another one, the cell size is smaller than normal, is called microcytic. RBC or hemoglobin or iron is less, hypochromic. So cell size small, iron small, microcytic, hypochromic. So because of the different type of anemia, we have some tools to measure. It is called MCV. You see, MCV. MCV means mean corpuscular volume. So the mean corpuscular volume, it is the average size of our red blood cell. If the MCV bigger than normal, right, and we can say macrocytic, or if it is smaller than normal, we said microcytic. So the mean corpuscular volume is the one tools to say normocytic, macrocytic, or microcytic. So normal MCV 80 to 95. If it is more than 95, means cell is bigger. If it is less than 80, we call cell is small and microcytic. Let me tell, or let me find it out. When the laboratory technician can see the red blood cell or MCV is more than 95 and patient has an anemia, they easily can say what kind of anemia. So it is macrocytic. Maybe the cause is megaloblastic anemia. Mega means bigger, and blastocyte means the red blood cell before the maturity. And megaloblastic anemia occurs because of vitamin B12 or folate deficiency. So vitamin B12 or folate is the important component of cell maturities. When lack of it, cell size is bigger, but it does not work well. So another one is called, we see from here, non-megaloblastic. One is bigger size, and there's a non-megaloblastic, maybe alcohol, liver disease, or myelodysplasia, or aplastic anemia. So aplasia, A means absence of plastic cell in bone marrow. Myelodysplasia, another cause. So I was saying macrocytic anemia developed if PCV is more than 95, right? The most important cause are megaloblastic. Underlying causes vitamin B12 or folate deficiency. So if patient only folate deficiency and develop the megaloblastic anemia, we can simply give them vitamin B12. Other chemical name of it is cyanocobalamin. So what are the non-megaloblastic reason? Then MCV is more than 95. Maybe patient give a history of alcohol intake or liver diseases or myelodysplasia. So if I ask you, what is myelodysplasia? Sometimes some clinicians say it is MDS, myelodysplasia. It is basically a group of disorder resulting from poorly formed or dysfunctional blood cell. What are the underlying cause of myelodysplasia? Our presentation are patient easily get tired, difficulty of breathing, or pale skin. Frequently they get infection or easily catch infection. So next one, another cause, aplastic anemia. If you read this, it's called A for absent. Okay, absent the plastic cell in the bone marrow. Aplastic anemia, very uncommon disease, but there's a problem in the bone marrow, and bone marrow does not produce adequate number of new red blood cell, and this causes tiredness, shortness of breath, rapid heart rate, also easily bruising, nosebleed, headache, and fever. Let me go back again. If MCV is within the normal range, I mean, mean corpuscular volume is within normal, 80 to 95, normocytic. What about MCH? MCH mean corpuscular hemoglobin. Don't miss this too, my friend. Okay, one is mean corpuscular volume, other is the mean corpuscular hemoglobin. Okay, so mean corpuscular hemoglobin or cell is an estimate of amount of hemoglobin in average red blood cell. Hemoglobin, because hemoglobin is a substance in the red blood that carry oxygen to the cell in the body from the lungs, right? So patient has a anemia, but patient MCV within normal and MCH more than 25%. If it is more than 25% means you okay. So, but patient has anemia. So what are the underlying cause? I have a good MCV, I have a good MCH, but still I have a anemia, right? What is the reason? The main cause is called many hemolytic anemia. What is hemolytic anemia? Or anemia of the chronic diseases. Mean I want to easily is if I make it easy, means everything is okay, but my blood cell easily break down before lifespan and patient develop anemia or any other chronic disease like pernicious anemia event or any kind of malignancies after acute blood loss, like a road traffic accident or patient has a rhabdomyolysis, even pregnancy, C-section, huge blood loss, and patient develop anemia, acute blood loss. So if I tell you acute blood loss, what kind of anemia develop? Normocytic, normochromic. Renal disease, normocytic, normochromic. Bone marrow failure, like post-chemotherapy. So if anybody diagnosed with a cancer and patient need chemical therapy or chemotherapy, they have a chance to develop anemia, and this is normocytic, normochromic anemia. Infiltration by carcinoma. Another one is micro, means smaller, because MCB less than 80. And also hypochrome, means iron also less. MCV less than 80. MCH less than 27, mean corpuscular hemoglobin also less. Most common cause iron deficiency anemia because hypochrome means iron go down. Other is thalassemia, right? So sometimes board question asks, in case of thalassemia, what kind of anemia develop, right? And you know, thalassemia is a genetic defect, thalassemia. So I said thalassemia is a genetic defect. So next here, if you ask me, I want to tell you it is gene-related problem or inherited blood disorder characterized by formation of abnormal form of hemoglobin, and it causes tiredness, yellow skin color, discoloration, dark urine, or abdominal swelling in case of thalassemia. Anemia of the chronic diseases or lead poisoning, also sideroblastic anemia. So this is the underlying cause of anemia, what is called microcytic anemia. Okay, So if you ask me, what is sideroblastic anemia? Sideroblastic anemia or sideroarchitect anemia is a form of anemia in which the bone marrow produces the range of sideroblast rather than the healthy red blood cell. Means abnormal red blood cell formation, right? So before to go next page, I want to tell something. In the bottom, we can see what are the meaning of MCH. It is called mean corpuscular hemoglobin. What are the meaning of MCV? It is mean corpuscular volume, right? So imagine this is the red blood cell, red blood cell. So out of red blood cell, how many concentration of the hemoglobin? MCH. So what are the cause of microcytic hypochromic anemia? One is iron deficiency anemia, thalassemia, anemia of the chronic disease, or lead poisoning, sideroblastic anemia. MCV less than 80, MCH less than 27, both is less. But if MCB within normal range, MCH normal, but patient has anemia, the most common cause, hemolytic anemia, anemia of the chronic diseases, after acute blood loss, renal disease, or mixed deficiency like bone marrow failure, like post-chemotherapy or infiltration by carcinoma or cancer. If patient has a bigger size red blood cell, macrocytic, MCV more than 95, it is called megaloblastic anemia. The underlying cause vitamin B12 deficiency or folate deficiency. Also, non-megaloblastic reason alcohol, liver disease, myelodysplasia, or aplastic anemia. So here showing the red blood cell size and iron. In case of iron deficiency, size is micro, means smaller. Folate deficiency, B12 deficiency, the anemia developed called pernicious anemia. Pernicious anemia occur because of vitamin B12 deficiency, and red blood cell is macro, means bigger, megalocyte. Anemia of the chronic disease, red blood cell size is normal. What about the MCV, mean corpuscular volume? We can say it is normal 82 to 90. In case of iron deficiency, it is decreased MCV. In case of vitamin B12 deficiency or pernicious anemia, it is increases. But anemia of the chronic disease, red blood cell size and MCV is normal. What about MCH? MCH, iron deficiency, it is low, means less than 27, or in case of vitamin B12 deficiency, it is normal or high. Mean corpuscular hemoglobin concentration should be high. In case of anemia of the chronic disease, it is normal. What is TIBC? TIBC means total iron binding capacity. TIBC. So a total iron binding capacity, it is a test we measure the body's or blood ability to attach itself to iron and transfer it around the body. So a transferrin test is similar of TIBC. If you have iron deficiency anemia, means your iron level will be low, but your TBC will be high because there's an iron binding capacity. So TIBC and ferritin, it is a little bit defined understanding. Like I said, iron, if we have enough iron in the body, the binding site would be occupied. But if my patient has an anemia because of deficiency of iron binding site supposed to be empty, means increase. So important to know. Okay. So I said TIBC. Let me tell one more time. It is total iron binding capacity, and TIBC test measure basically blood availability to attach itself to iron and transport it around the body. And transferritin test is similar. And if you have iron deficiency, a lack of iron in the body, and our iron level will be low, but TIBC will be higher. So what we can see in case of iron deficiency, TIBC high, but ferritin level low, because body deficiency of iron, but iron binding capacity is increased because it is empty. In case of B12 deficiency, it is normal. B12 deficiency, ferritin is higher, but anemia of the chronic disease, normal, or low TIBC, ferritin is normal or higher. B12, in case of iron deficiency, it is normal. Folate, it is normal. But B12 deficiency or pernicious anemia, B12 level down, but folate is normal. In case of anemia of the chronic disease, normal, right? And what else? The folate. All case, folate is normal. Iron deficiency, B12 deficiency, anemia of the chronic disease, normal. The red blood cell, this is red blood cell size, this is red blood cell number. In case of iron deficiency, it's supposed to know low. Hemoglobin amount 12 to 16, it is low. B12 deficiency, it is low. Hemoglobin lower. And anemia or chronic disease, low and low. So what we learn from this table? We learn in case of iron deficiency, between B12 deficiency, or pernicious anemia, or anemia of the chronic disease, all cases we can say red blood cell or hemoglobin is low, 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 right? This is common. But in case of RBC size, in case iron deficiency, it is smaller, B12 bigger, megalo, but this is normal. The easy and good way to remember, in case of anemia of the chronic disease, normochromic, normocytic, MCV normal, MCH normal, iron binding capacity normal or low, ferritin is normal or high, B12 normal, and folate is normal. It's easy to remember. But in case iron deficiency anemia, we can see MCV decreased, MCH low, binding capacity increase, and folate is low. When folate low, binding increase. When folate is normal, binding is normal, or it should be not low. Okay. In case of B12 deficiency or pernicious anemia, we can see MCV increase, MCH is normal, and iron binding capacity is normal, ferritin is higher because there are no empty space because we have enough iron. And B12 and folate, in case of B12 deficiency, definitely B12 is supposed to low because it is B12 deficiency. But folate must normal. And both here, iron deficiency, folate is normal, B12 is normal. But B12 deficiency, B12 is not normal, it is lower. So here is few compare and contrast between iron deficiency, between B12 deficiency or pernicious anemia with anemia of the chronic disease. Yeah, in this table, we can say complete this chart as a study guide. Basic mechanism, iron deficiency anemia, they said decrease the iron leads to decrease the heme synthesis. Anemia of the chronic disease, decrease the erythropoietin or relative basis of decrease the erythropoiesis shorter the RBC life. So erythropoiesis means the red blood cell formation, genesis. Okay, we need enzyme and nutrition to produce red blood cell. In case of sideroblastic anemia, decrease the synthesis of porphyrin ring. So if we go the structure of hemoglobin, there are one kind of carbon structure, it is called protoporphyrin ring. So sideroblast anemia means structural defect, decrease the synthesis of this ring is called protoporphyrin ring. In case of hemoglobin pathogenesis, decrease the hemoglobin because of genetic defect, messenger RNA. What else? MCV and MCHC, hemoglobin corpuscle volume and hemoglobin corpuscular concentration, hemoglobin, I said total, mean corpuscular hemoglobin concentration, easily called. And now another one is both case, it is reduce. Iron deficiency, anemia of the chronic diseases, sideroblast or normal. So how we corrected reticulocyte count. So reticulocyte count is the red blood cell stage before mature RBC. Reticulocyte, the iron deficiency anemia, reticulocyte normal or low. Anemia of the chronic disease, it is normal. Sideroblast, typically normal. And also peripheral blood smear. If you go for peripheral blood smear study, we can get anisocytosis, poikilocytosis, or we can see the target cell. So peripheral blood smear, I said sideroblast, we can see special type of cell called sideroblast cell. But in case of iron deficiency or hemoglobin pathesis, we can say anisocytosis or poikilocytosis. The difference between these two keywords, in case of anisocytosis, it basically that is the patient blood cell are unique size. Commonly, all blood cells supposed to be same or uniform, equal size. It is unequal. And poikilocytosis means we see here less deformed cell, unequal but normal. And serum iron TIBC, in case of, we can say TIBC low, elevated normal, and all is low iron. But anemia of the chronic disease, it is low, normal. TIBC normal, saturation low, ferritin normal, and hepcidin high. So let me go next. Here, it is extra little bit, but I want to read it is because some of the students are very interested. They want and they like to ask something more. So let me go here first. Anemia detected by CBC. CBC means complete blood count. Elevated MCV and look for other flag on CBC report for presence of abnormal red blood cell and examine peripheral smear. First of all, anemia detect by CBC, then evaluate MCV, and if MCV is low, it may be iron deficiency, so need to iron study. If iron study, just find out low iron. If it is low iron, by high TIBC, binding capacity is high, low iron, or sometimes normal or low TIBC, or normal or high ferritin. So you see, different patient is different. Individual patient is different, right? So this is the reason when we do and practice, don't do anything blindly. I saw they gave iron deficiency and give the same treatment doesn't work for everybody. So they said low iron, high TIBC, low ferritin, iron deficiency, anemia. But iron studied low iron, normal or low TIBC, normal or high ferritin, anemia of the chronic diseases. And another normal to high iron, any TIBC, normal to high ferritin, iron overload. And another one, MCV is normal, but patient has anemia. So they require additional testing, such as examination of the peripheral smear for abnormal RBC, or presence of hemolysis, maybe increase LDH, this is one enzyme, lactate dehydrogenase, or increase the inadequate bilirubin, or decrease haptoglobin, presence of blood loss, bone marrow suppression, or renal insufficiency. Another one, MCV is increased more than 100, maybe dysplastic failure or cytopenic present, or serum vitamin B12 or folate level we need to check, or methyl myelinate enzyme, or homocysteine. So if MCV is increased and we can say dysplastic or cytopenic present, it is myelodysplastic disorder. But if patient has serum B12 and folate level, we need check and we see low vitamin B12, elevated this enzyme, elevated homocysteine, but low B12, it is iron B12 deficiency. But if low folate, normal methylmalonate, and elevated homocysteine, folate deficiency. It is a vitamin B12 deficiency. What next? Next, we can say if patient present with low hemoglobin, MCV is more than 95, RBC is macrocytic, means little bigger. We have to count reticulocyte. As I told you, reticulocyte is a cell just before mature cell. And if reticulocyte is normal or decrease, maybe macrocytic size is bigger, but no hypersegmented, or sometimes macrocytic hypersegmented with poly. Bone marrow, not megaloblastoid. Here, vitamin B12 deficiency or folate deficiency. But here we can see bone marrow, myeloblastoid cell. Rollout need to refractory anemia, drug-induced liver disease, aplastic anemia, myeloid dysplasia, or sideroblastic anemia. But if we can say reticular count is increased, maybe it is hemolytic anemia. Because when reticular sound is produced, but reticulocyte is broken down, and then body send a signal to the brain, and brain can produce more and more cell, but this more and more cell easily break down, and patient develop hemolytic anemia. Next, one of the easy flow chart again, microcytic means smaller than normal. We need to check iron or ferritin. If ferritin low, iron deficiency anemia. If ferritin is normal, need to check inflammation or clinical sign symptom or CRP. CRP, C-reactive protein, is the marker for inflammation. If CFT is increased, inflammation present. If CRP is normal, no inflammation. What are the reasons of inflammation? We need to figure it out. Maybe consider anemia of the chronic disease, or check full iron study to ensure not iron deficiency. No inflammation, consider thalassemia. Here we can say anemia is a flowchart. Micro, small, normal, or macro means bigger. If it is smaller, hypochromic, normocytic, or normocytic. If it is normocyte, maybe thalassemia. If it is hypochrome, normocyte, low ferritin, iron deficiency. Hypochrome and normocyte, but ferritin is higher, anemia of the chronic disease. But normocyte, normochromic, or hypochromic. If it's hypochrome, iron deficiency, or anemia of the chronic disease. If it is normochrome, regenerative reticulocyte count more than 1%, it is hemolytic. And non-regenerative means reticulocyte less than 1%, renal failure, it is leukemia, or aplastic anemia. In this histology of red blood cell, we can say this is the cell, normal red blood cell, but this is the smaller. It is microcyte, right? Or autoimmune hemolytic anemia. And here we can see some kind of special cell. This is called target cell in case of sickle cell disease. Target cell present in case of sickle cell disease. And here cystocyte microangiopathy, hemolytic anemia, or it is called DIC, disseminated intravascular coagulation defect, or TTP means thrombocytopenic purpura, or HUS, right? So next here we can go a special type of anemia. It's called aplastic anemia. So here we can see two pictures. Normal blood cell is full of cell, but it is aplastic anemia. You see the cell are very few. And this is the long bone, and this it is called bone marrow. So if the bone marrow problem, so what is aplastic anemia? A means absent. So it is a pathological condition in which the body does not produce enough red blood cell, and that is required for normal function of the body, which result in variety of symptoms. So in case of aplastic anemia, there are absence of cell. Here we can see severe aplastic anemia, very severe aplastic anemia, and moderate aplastic anemia. So this is the grading of aplastic anemia. So moderate aplastic patient with a pancytopenia who do not fit for criteria for severe diseases. So pancytopenia means all of the cell, red blood cell, white blood cell, and platelet all go down, and patient develop pancytopenia because of aplasia. Severe aplastic anemia means absolute neutrophil count, absolute, let's say, less than 200. Bone marrow cellularities in case of severe aplastic anemia, less than 30%. 2 or 3 peripheral blood criteria we can see. One is absolute neutrophil count, platelet count, and reticular count. So if you count, you can say reticulocyte less than 40,000 cubic millimeter, platelet less than 20,000, and absolute neutrophil count in between 500 to 200.